Okay, we've reached the end of our time, but if you have any questions and you want to make your way to the mics, just remember to state your name and your affiliation before asking your question. Let's give a round of applause for the speakers.
Laura Wolf, HHS Asper. Want to give a shout out to my colleague from DHS. I'm the SSA lead for the healthcare and public health sector-specific agency, so you'll hear about what opportunities we have for our partners in healthcare and public health later today. But I have a question for the academics on the panel, similar to what had been asked previously. What is the data that you can't find that you wish you had for your analyses? And does it exist and you can't get it, or does it not exist?
I can say a few things. I think it's on. Yeah. Mm-hmm. So one thing that's been coming out and going out on the websites is the shortage data. So like if you wanted to look at historic shortages of which drugs came into shortage, got out of shortage, what does shortage exactly mean? That's one data set that would be very useful to kind of match up with the historic orders and distributions that we're observing to kind of see patterns that exist. I would say that would be very, very important.
I'll highlight something that also leverages what Prashant was saying too, this idea of mapping upstream supply chains. Understanding relationships that companies have in terms of who their suppliers are, that cascade, that network, being able to map that in, I'll use emergency management language, blue sky times, and understand those relationships and those flows. If we can have that mapping, and we have some ideas on how to create a trusted relationship to enable that information sharing so we can map the network and the flows that typically happen. Then we can use analytics to then determine where we're proposing these sentinel points that you'd want to track during a crisis, the most important points. So being able to capture blue sky operations for critical commodities in the health sector and talking with some of the key players who may control a lot of this. In the medical distribution sector, obviously, there's a lot of concentration. So that's one area we're looking to get data now for our study to come up with this approach on sentinel indicators.
I think in similar vein, I feel some of this data of mapping requires primary data collection, but some of it sits in the DMF files. And I think if the federal agencies involved are able to create a structure where academics who are researching this can have access to who are the suppliers, what is their declared capacity, I think it will create a way of looking at resilience and mapping it in a much more rigorous manner.
And some of this data actually exists and collected, like IQVIS, I think has some of these, but it's not at the right granularity, and sometimes it's extremely expensive data.
Thank you. Yes, sir.
Observation, Chris Hoff from the DuPage County Health Department. And Jared, you had a slide, one of the slides that showed the factors contribute. You had a slide that showed the factors leading to shortages, and it looked like the number one factor was a mismatch between supply and demand. And it was interesting to kind of look at that in the context of how we respond and mitigate these shortage situations, and understanding whether it's really just having the right product in the right place and being able to collect data at the time of the event to reallocate that supply versus being able to manage raw material through the pipeline kind of to new deliveries. So how did that data, how were you able to access that, and is there a similar model for doing that now for domestic type emergencies?
Yeah, so that was an observation from talking with the people who responded to the Ebola crisis, saying this is the biggest issue they had. I'm not sure that they had data on how to identify this, but I mean, it was mentioned earlier today too, understanding a picture of what the true demand is and trying to capture that and distill that is always elusive. And the best way you can do this is by sharing information, enabling a sharing of information across organizations who are observing demand to get that clear picture. And then this idea of also sharing information about supply. And it was mentioned in the morning panel that, and I've observed this too, that even competitors during a crisis have a common goal, and there's an openness for a period of time to share information about where supplies are going. And I think that there's an opportunity to create trusted relationships like what DHS does, but also even in an open setting to be able to share that information more effectively, to see where supply is coming, where true demand is. And I'll say one thing too, and FEMA is actually looking at this too, how they can communicate what they're doing, right? Back to that I mentioned at the beginning, the plan, the demand plan and a supply plan. If we can share what we're planning and what we're observing, then we'll get a better picture of supply and demand. It's difficult, but I think we can do better.
Okay, great. Thank you so much.
Thank you all. It's always helpful to have folks who are not necessarily inside the box in the way some of us are, and it's really greatly appreciated. Thank you. Teşekkür ederim. So we've now reached a point where we can all go out and mingle a little bit and catch up with all the local gossip, the op-ed piece, the whatever. But I would encourage you to continue to sort of communicate with each other, because this is a theme that I think we're all hearing, is communication. So we've got a 15-minute break in front of us, and then Aaron's going to lead us into the next panel at 11 o'clock. So go have a cup of coffee and chat. We'll talk to you in a bit.